Good afternoon. I want to introduce Dr. Chris Lick-Skye, who is an Associate Professor of Medicine at the University of Western Ontario. And we're here to talk about the Air Quality Health Index and asthma action plans. Can you tell us about your study and its results?
Yes. So our objective was to create a dynamic, real-time asthma action plan. So as you may know, the asthma action plan is a self-management tool that's meant to be used by all asthmatics as they become engaged in their own chronic disease management. The simple notion is that working with their healthcare team, we create a tool that allows them to manage their disease for the entire year, so that they might see their doctor 3 or 4 times a year. They're responsible for managing their disease for the entire rest of the year. So the asthma action plan is set up generally around a traffic light theme, which tells people how they should manage their asthma when they're in regular control, in the green zone when they're in good control, in the yellow zone when they're slightly out of control, and in the red zone when they're very out of control. And for each of those levels, we advise people on what specific actions they should take. The written plan has been demonstrated when used in the context of regular clinical care to improve health outcomes. And we thought there would be a real advantage to creating or to taking that static document and to bringing it to life on a smartphone application so that individuals would carry it with them every single day. That if they entered data on a regular basis, that we could accurately assess their level of control and feed that back to them so that they would well know that they were in the green zone, yellow zone, or red zone, and that they would be able to take the specific actions that their healthcare team had advised for them to take in that zone. The other aspect of having a real-time dynamic tool like this one is that we have the opportunity then to provide them with current environmental information. So there are many things that can trigger off asthma in the environment: pollens, air quality, and we integrated the Air Quality Health Index into this application so that individuals could at any point in time look at the current air quality information and receive the health messages from Health Canada that would be associated with that, and to reduce their risk of having an attack, if you will, because of exposure to poor air quality. So I guess in sum, the notion was to take a very good paper-based static tool and to turn it into something that was alive, that would interact with the individual, communicate with the individual in real time, and engage them very actively in their care.
And something that in today's climate of social media would be very relevant.
Absolutely.
Since people don't go anywhere without their smartphones these days.
And I think that's very true. And so the data that we have on that really is from marketing firms. But at this point, somewhere around 6.6 million Canadians have a smartphone. And this is an area of rapid growth. And there, I think, are tremendous opportunities for engaging people in their own management by getting them involved with an application that relates to their health. I mean, we all know that people, many people are using applications in all aspects of their life. And this is such an important area to think about using applications to improve health outcomes.
When we're teaching people to manage their asthma, how do we integrate this tool into that education, and how do you work with the patients to help them use it?
So as part of this project and in general around asthma management, we advocate for a collaborative team. The team involves the patient, a certified respiratory educator, and a physician. And we rely very heavily on the certified educators to teach people about their disease, about their triggers, about regular daily asthma management, about avoiding triggers, about how to use their device properly, how to monitor their asthma, how to assess their control, etc. And I would see this tool as a valuable adjunct to that type of education, and recognizing that not all individuals, not all residents have access to a certified respiratory educator, it may help to serve a need where certified respiratory educators are not available. So ideally, that tripartite team, educator, patient, physician is the ideal. But the tool, I think, creates an opportunity also to educate people beyond that. So it may be in addition or as an adjunct to that, but also it could be that when the tool is developed in its final phase, that it could be quite an effective tool for you to pick up, to download, and to start using on your own. In this study, for example, we looked at knowledge acquisition. Well, part of being able to manage your asthma well is to understand how to evaluate control, so you know what zone of control you're in. Part of it relates to the knowledge about the action plan in general, what it's all about. And in this study, we included air quality information, so we needed people to learn about the air quality health index, and we may need to do that for other environmental exposures that are important. And what we were able to show was that from the onset of the study, we had a baseline knowledge, and from regular exposure to their action plan, to AQHI information, over the course of about 3 months, there was a marked improvement in the knowledge as it relates to their chronic disease management. Most of that occurred outside of the clinic. So they had some baseline knowledge and baseline teaching, and then they had their smartphone. We know they looked at their action plan at about every other day. We know that they looked at air quality information about 60 or 70% of days. And so that regular review helped them to learn about that. Now, we didn't specifically evaluate confidence or self-efficacy, the ability to not just have the knowledge, but then to confidently execute on that. On the other hand, we did ask people, once you saw the air quality information, did you take action based on the Health Canada messaging? And more than half of the subjects had taken action on the basis of it. And we asked them about when you saw your action plan information in terms of the zone of control on the smartphone, were you surprised by it? And many were surprised that they weren't in control because they thought they were in control. And that's very consistent with what we understand about the asthma population in general. But perhaps more importantly, when they saw that they weren't in control, a majority of them took action based on the smartphone recommendations that they saw in front of them, those that had been created by their healthcare team. So while we didn't formally evaluate self-efficacy and confidence, it seemed like people did feel confident and took action based on that. So I think it has a real opportunity to educate people, to engage them actively, and to help them build their knowledge and their confidence about managing their own disease.
So this has been very helpful for the patients. How easy is it going to be to encourage physicians to use a smartphone application to help their patients manage their disease?
Well, I guess I don't know the answer to your question. I guess similar to most innovations, I think there will be initially some healthy skepticism about whether this has a role. And I think that's a challenge, and I think that's as it should be. When new technology comes down the road, I think we want a thoughtful approach to its implementation. But having said that, I think physicians, like most other people in the community, have an appreciation for the power of mobile computing, for the, and an interest in how we can use these computers that we all wear on our belts and in our bags, and we call them phones, but they're really pretty complex electronic tools. And I think in general, physicians will embrace an opportunity to engage their patients in this type of chronic disease management support. But as we move this idea forward and we test it, in different sites across Canada, that we will see.
And do you think it will be easier in physicians that are more familiar with social media than with people like me who might be mired in the 20th century technology?
Well, I think I do have a bit of a sense that, and one of the concerns I had at the very beginning, I suppose, was that the smartphone health-related application might be a tool that only the youth group, the younger population would be interested in. But, you know, when I look at my own belt, I have a smartphone. I don't fall into the youth category anymore. And when I look at my colleagues and I look at other professionals and I look at 6.6 million people across Canada that have smartphones, this is a technology, I think, that's moved well beyond a certain demographic, and it's insinuated itself into the population. And so I think docs are part of that population, physicians in general, and you know, I think the technology will fit nicely in the whole movement towards electronic tools in healthcare, electronic medical records, smartphone applications, telemedicine, telehealth. And I think anything new will take some time to move ahead, but I don't think there'll be very much resistance to this, and I think most of the physician demographic will embrace it.
And so we can look forward to more and more physicians integrating air quality information into asthma management.
I think that's fair to say. You know, we certainly plan to include environmental information like air quality, the AQHI, in this application because we believe it's very important to identify triggers, and air quality is an important trigger for people with asthma. I think that may help to roll out the message around the importance of air quality and moving forward.
I think you're right. Thank you very much.
Okay.